Hello, my name is Burt Deweese, physical therapist and Vice President of Operations here at Rebound Physical Therapy. At Rebound, we're dedicated to returning our patients and clients to an active and healthy lifestyle. Today, I'd like to talk about balance. Balance is one of the more common conditions that we do see here in the clinic. Some of the reasons may be from falls, or near falls, where people are starting to trip. We got muscle weakness. We got decreased mobility. And some people may start walking with a cane or even a walker if their balance becomes more impaired. There are a couple areas that affect your balance, and the three I'm going to talk about are the eyes, the inner ear, and the sensation of touch. Okay, so those three work together. If any one of those systems has a dysfunction to it or is reduced, it can affect the others, and then you may start having balance problems. So the eyes give us information about depth perception. It gives us information about vertical alignment. So anytime our vision is impaired, that can affect how we're walking and how we move. The inner ear system is your main balance center. So there's little sensors in that detect rotational movement and up and down movements, as well as walking forward and backwards. So it gives you information about what's going on in space. And then the sensation of touch is your feet give you a lot of information when you're walking, when you're standing, if you're walking on uneven surfaces. So the sensation of touch gives a lot of information. Well, those three combined go to your brain processes all this information, then it sends information back out to respond to any changes. Whether you're walking and you lose your balance, whether you're walking and you get on an uneven surface, your brain has to be able to respond quickly to correct that imbalance. So some of the things we do here, so if we have someone who has an imbalance issue, when they come in here, we are going to look at ways of treating their inner ear system, as well as that information coming from your feet. So we may put someone in a position where they have to stand, shoulder width apart or closer. Ask them to turn their head side to side. We may ask them to close their eyes. Okay, and so when we do that, we're taking away, one of those components and making the others work better. So if we were to take away the eyes and close the eyes, we're left with the inner ear system and the sensation of touch. Okay, so we can challenge and play with the systems that way to improve the ability of those two systems to work. Okay, we can put someone on a cushy foam, so it's like you're standing outside on grass or uneven surface. And so now you've taken away the information that comes from your feet. So now you're left with the inner ear system as well as the eyes. If we were to take away the eyes in that setup, then we'd be left with the inner ear system. So now your inner ear system has to do most of the work. Okay, so those are ways we can train the different systems that we use for balance. So one of the exercises that I'd have people do at home to start with is you can have your feet, shoulder width apart or even all the way together. Your arms across your chest so you can't use them as a tightrope walker. And then you're going to stand there and you're going to just maintain balance. You're going to try and avoid swaying back and forth or side to side. And we're just going to stand there nice and still. And then we're going to add head movements to that. So you can turn your head to the right and pause. And you can turn your head to the left and pause. And again, this may cause you to drift one way or the other. And then we may ask you to close your eyes. So with your eyes standing closed, you're going to really feel what's going on with your feet and legs because we're taking away that visual awareness of where you're at in space. Okay. And then with eyes closed, we can do back the head turn right, head turn left. And that's a simple thing you can try at home. And if you were doing it at home, I would have put a chair behind you or stand in front of a countertop where you can grab it quickly. But try not to touch it because, again, touch gives you information. If you or someone you know of has any balance problems and they feel like they'd benefit from talking with one of our physical therapists, we do free screenings here. So you can come in, sit down, talk with one of our therapists, and learn a little bit more about what may be going on with your balance. If you know that you need an evaluation, just give us a call. We'll get that all set up. And you can just come in, we'll do the evaluation instead of doing just a screening. So give us a call at 271-5533, and we'll get you set up for an evaluation. Thanks.